2015, we centralised all urology service onto one site at St Peter's Hospital, and the Urology Centre was opened. A wide range of activities are conducted from this centre, including nearly all operations, most clinics, catheter management, all urological treatments and other urological investigations. We still carry out some clinics at satellite sites to reduce patient journey times and for convenience.
In the Urology Centre, we look after patients with all different types of urology problems, and this can relate to prostate, renal, bladder and testicular conditions. Your care is delivered through a patient-centred approach from our team of consultants and nursing staff.
We have a large core urological team, really more of a family. And what makes work life enjoyable is that everyone gets on with each other with a great deal of team spirit. And our true aim is to help each patient on their individual journey. I'm one of 7 consultants on the team.
We're also fortunate to have 5 urology nurse specialists, 3 of whom are cancer nurse specialists. We all support one another, but Janine and Wayne mainly concentrate on catheter care, urology treatments, and education of staff across the trust. We all look after both cancer patients and patients with benign conditions, but Terri, Vicky and I provide specialist input and support for patients who receive a diagnosis of a urological cancer. This can be in the form of emotional support and practical advice regarding their condition, assisting both patients and families to cope with treatment, side effects and the future.
We currently have 2 clinic consultation rooms, but we're looking to increase this in the not so distant future. You'll be seen at your appointment by one of our urology consultants or nurses. At this initial meeting, a history of the presenting problem will be taken and you may be examined.
As a result of the consultation, a series of investigations may then be required, such as providing a sample of urine, and bloods may be taken from you, which can be taken in the centre itself. You may then be required to undergo, on a different day, either an ultrasound, a CT scan, an MRI and a bone scan, or a combination of these images depending on your presenting condition.
A large part of our work is related to catheter care. We provide nurse-led clinics for all difficult male and female catheter changes, both urethral and suprapubic, and a drop-in service for current urological patients with problematic catheters to deviate patients away from A&E. This has really helped reduce A&E attendances and improve patient experiences.
Flexible cystoscopy is a common investigation and involves passing a small telescope into the bladder under local anesthetic. It generally takes 3 to 4 minutes, and the aim is to inspect the urethra and bladder, looking for any abnormalities.
We also perform a wide variety of treatments in the Urology Centre. We instill medications such as BCG and mitomycin C into the bladder as part of managing certain bladder cancers.
Also, we provide a lithotripsy service whereby renal stones or ureteric stones may be fragmented non-invasively. There are criteria for this approach, and each session usually takes half an hour.
Urodynamics investigates how well the bladder and urethra store urine and expel urine. It provides objective evidence of the function of the bladder by measuring pressures within the bladder. This really helps us to guide treatments.
Any patient with a newly diagnosed cancer has their case discussed at the Urology MDT meeting, which occurs once a week. MDT stands for Multidisciplinary Team Meeting, which includes the urology consultants, consultant radiologists, oncologists and pathologists, and the urology cancer nurse specialists, all overseen by Zoe, our MDT coordinator. Cases are presented by the urology specialist registrars, and all scans and pathology are reviewed with appropriate management plans devised.
If you require an operation, you will be given a date for the operation by the central bookings team. You will have a date for pre-assessment where your general health and fitness will be assessed by way of carrying out further investigations or tests prior to your surgery. On the morning of your surgery, you'll be invited to the admissions lounge where you'll be seen by a member of the surgical team, where your operation will be outlined and a consent form completed. You will also see the anaesthetist and then be prepped for theatre.
At the start of each operating list, a team brief is conducted. During this brief, all cases are discussed with the aim of good communication amongst all theatre staff involved. Any special circumstances or specific concerns are highlighted and appropriate steps are prepared and taken as required.
Following your operation, you'll be wheeled into recovery where you'll be closely monitored as you come around from your general anaesthetic. Once you're awake and alert, you'll be transferred to either the day ward or one of our inpatient wards. There are a team of dedicated nurses here who will continue to monitor your recovery until you're safe to go home. At this point, your visitors will be very welcome to see you.
To be safely discharged, you need to be mobilizing, eating and drinking and passing lots of water. You'll be given a discharge summary which will outline the operation you've had and our post-operative plan. An information leaflet will be given to you which will provide the explanation about the post-operative instructions.
If your operation requires a longer inpatient post-operative period, then you will be admitted to one of the surgical wards, usually Falcon or Kingfisher ward, and you will be seen on a daily basis by the consultant-led urology team.
The team consists of registrars, core surgical trainees, foundation doctors and physicians associates, and any member of the team will be able to answer any questions you may have.
We also have a dedicated senior nursing team on each ward who are well versed in managing urological conditions and post-operative care. Again, they'll be more than happy to reassure you regarding any concerns you may have.
Our secretaries form a key and integral part of our service. We call this the engine room, where a number of calls are received and dealt with, and a huge amount of activity is organised and processed.
We take phone calls from many of our patients and strive to answer their queries and direct their care accordingly. We do our best to ensure tests are all in process and organised in a timely fashion and chase up when these have not occurred. It is very rewarding if we have been successful in helping patients along their journey.
We have a weekly consultant meeting attended by all the urology consultants, the service manager, the Associate Director of Nursing and myself as Associate Director of Operations for Surgery. This meeting allows an in-depth discussion of current demands so that activity can be tailored accordingly. This results in better efficiency and flow through the service and ensures the entire team are working together and that service problems are resolved quickly.
We have 2 very dedicated registrars and receive medical students from Imperial College School of Medicine and St George's Medical School. Ward rounds, clinics and theatre sessions all provide useful opportunities to train up our doctors for tomorrow.
As registrars, both myself and Andrew receive excellent urology training as part of our rotation around the Kent, Surrey and Sussex region.
Here at Ashford and St Peter's, we really take your care seriously. As part of our commitment to you, we strive not only to provide excellent healthcare, but aim to continually improve so that we may truly pride ourselves on delivering a patient-centred and patient-focused service.